The experience of osteoporosis. I remember when I was a child, Father often took me to the park nearby. He always gave me a ride on his shoulders. In my memory, he had strong shoulders and a powerful trunk. When such a small guy like me sat on his shoulders, I could see the whole world, just like he was my secure castle and shelter. Many years later, we took a walk in the same park again. He had neither strong shoulders nor a powerful trunk, but a hunchback, slowly walking with a cane. Some time ago, a serious fracture occurred to Father while he was moving something heavy. He was hospitalized and needed an operation. The doctor said Father had seriously insufficient calcium because of long-term fatigue and malnutrition. In the course of time, osteoporosis occurred. Potential crisis of osteoporosis. Osteoporosis usually comes over many years. It's usually painless at first, so you won't realize osteoporosis has silently eroded your body until fractures or aches appear. Thus, osteoporosis is called an invisible killer. Moreover, World Health Organization established World Osteoporosis Day, held on the 20th of October annually. Osteoporosis results from calcium loss in the bones, causing serious bone loss. It makes bones brittle and fragile. Even a slight bump can cause fractures. Fractures caused are usually of the wrist, spine, and femur. Patients have such symptoms as broken carpus, backache, loss of height, hunchback, and transcervical fractures. Statistically, there are up to 130,000 fractures resulted from osteoporosis annually. Among them, 3,000 to 5,000 of these people died from complications of transcervical fractures. American Medical Association indicated that among the elders with transcervical fractures, around 5 to 20% of patients died within a year, and disability in 50% of those who survive and need others' help in their lifetime. It's really astonishing. Accordingly, 1 in 3 women from the age of 60 to 70 have osteoporosis. Furthermore, up to 2/3 of women over 80 suffer from osteoporosis. Why women are more likely to suffer osteoporosis is the changes of bone metabolism after menopause. The deficiency in estrogen speeds up the loss of bone. Many people misunderstand that only women will have osteoporosis. In fact, the disease can strike both sexes, but women are more likely. Statistically, women are 8 to 10 times more likely to develop the disease. The connection between calcium and osteoporosis. In his book entitled Calcium in Health, Dr. Takuo Fujita of Kobe University, Japan, pointed out that calcium can maintain the hardness of bone as well as prop up our body. A fixed amount of calcium in blood keeps the function of brain, heart, and hormone secretions normal. As blood calcium concentration drops below the standard level, it causes cramps in the limbs, blunt brain, imbalanced heart function, irregular pulse, etc. Evidently, irregular calcium ions concentration will start a panic in our body and threaten our lives. Thus, only with calcium can we keep healthy and maintain our lives. Therefore, calcium is the life fountain of bones as well as the flame of life. Our bone is a kind of active tissue in continuous metabolism, in which includes two important bone cells. One is osteoclast and the other is osteoblast. Osteoclast specially destroys old bone, but osteoblast aids the growth and development of new bones. Such repairs are a lifetime in progress. An individual's peak bone mass is typically achieved by around the age of 35. After 40, more bone is removed than is laid down, resulting in a decline in bone mass and makes inner trabecular bones brittle and cortical bones thinner. So the whole bone structure becomes fragile, forming osteoporosis. The truth of calcium loss and the absorption principle. Now compatriots have acknowledged the connection between calcium and osteoporosis, and common people think taking calcium can sufficiently prevent osteoporosis. Therefore, there are different calcium-related nutrition supplements on sale. But while you are actively taking calcium supplements, and there is rich calcium levels in our meals of chicken, duck, and fish, do you really think the calcium you ate can sufficiently go through your bones? Do you think you have successfully prevented osteoporosis? Now let's learn about the truth of calcium loss and the calcium absorption principle. After the calcium in food digests through our stomach, it is dissociated into calcium ions by gastric acid and then gets absorbed in the small intestine. Through sufficient vitamin D3 in the small intestine, the absorption of calcium can be accelerated, but generally, only 50% of calcium can be absorbed. In the process of calcium absorption in the small intestine going to human cells via blood, a maximum of 20% can be absorbed. Consequently, the calcium we eat is seldom absorbed. The Department of Health suggests adults' daily intake of calcium should be 1,000 milligrams, but only 100 out of the 1,000 milligrams of calcium can be effectively absorbed. You may probably think actively supplementing calcium can be similarly effective if the absorption of calcium is up to 1,000 milligrams, but it has been wrongly noted that non-absorbic calcium is metabolized by the liver and kidney. In the course of time, the burden on the liver and kidney will increase. If the metabolism of liver and kidney is weak, some calcium minerals will fail to metabolize. Over a period of time, the symptoms of high calcium blood or calcified bone will occur. Why do we lose so much calcium that we eat? Let's talk about the truth of calcium absorption again. After calcium ions are absorbed in the small intestine to the blood, they will be carried to wherever it's needed through blood circulation. In the process of circulation, blood should combine with calcium via a kind of protein called calcium-binding proteins, secreted by humans, thus sufficiently bringing calcium to human cells. But individual calcium and calcium-binding proteins are inactive. Once they combine together, an active reversible compound will be formed. Calmodulin contains the most calcium-binding proteins. Calmodulin, calcium-carrying protein in Chinese, or simply CAM. Introduction to Calmodulin. Calmodulin is an active protein formed from 148 amino acids. It already exists in our body, secreted from cerebellum cells, digestion cells, and sex cells. Calmodulin itself chelates with 4 calcium ions, and its structural bond will have coordination according to the need of calcium ions in each cell. If calcium ions are insufficient in cells, Calmodulin will release chelated calcium ions for the body. If calcium ions are excessive in cells, Calmodulin will take redundant calcium away. The peak secretion of Calmodulin is achieved by around our 20s to 30s. Afterwards, through aging, the amount of its secretion starts decreasing. That's why when elderly people take calcium supplements, none is absorbed. To disclose the truth, it's impossible to sufficiently supplement calcium without Calmodulin. Besides clinical proofs of regulating the concentration of calcium ions to prevent osteoporosis, Calmodulin can regulate the nervous and endocrine systems, activate the enzyme system, start the energy of body, and activate macrophages. Now the medical theories about Calmodulin have been generally recognized academically and medically. For example, Calmodulin was translated as calcium-carrying protein in Newton's medical dictionary and calcium-regulating protein in Pat's medical dictionary, which means an intensifier for many enzymes, and can regulate the concentration of calcium ions. Furthermore, domestic and foreign textbooks about the theory of Calmodulin have been progressively published. Special visit to Dr. Wang Kai-hua about the benefit of Calmodulin and research experience. Dr. Wang Kai-hua, internationally renowned in oncology and bioengineering, residing in America, has experience and knowledge in the research of Calmodulin over 30 years. She successfully mixed calcium Calmodulin as a high biotech product with her professional knowledge. Now let's see the medical background of Dr. Wang. Dr. Wang devoted herself to the research in immunology, bioengineering, and oncology. 1954, graduated from Beijing Medical University. 1960 to 1982, was a medical professor in Shandong University and the head of the Cancer Research Organization. 1982 to 1989, was a part-time medical professor in Xiamen University and the chairwoman of Xiamen Cancer Research Center. 1990, established Ionic laboratories in America for development of biotech research and medicine production. Dr. Wang's achievements in medical research are listed below. 1957 to 1959, devoted herself to the research and development in the biochemistry of hepatitis and the test of cytochemistry. 1958 to 1974, participated in the research of insulin synthesis. 1963 to 1966, studied and created effective medicines to rebuild the nervous system. 1972 to 1974, studied tumor-related antigens and a skin test for cancer. 1974 to 1980, researched in cell factors, thymus hormone, interleukin-2, interferon, and tumor necrosis factors used in clinical treatment. During this period of time, Dr. Wang's greatest achievement was to successfully develop high biotech products, such as calcium Calmodulin, with her professional knowledge, proclaimed the good news for human health.
1972年，我接受国家的重点研究项目，进行肿瘤免疫的研究。大家知道，肿瘤是由很复杂的病因造成的，所以需要研制一系列的药物来治疗和调控。在研究过程中，我发现 CAM 是最好的调控药物之一，几乎适用我所治疗的所有病人。CAM 呢，可以跟手术、化疗、放疗结合，可以达到更好的疗效，尤其是对一些年老病弱的病人，这些人呢不能用常规治疗，那我们只好用 CAM 来治疗，那达到很 很好的控制病情恶化，甚至于可以让肿瘤缩小的神奇效果。在长时间的临床观察中，我发现一些骨质有毛病的病人，随着他服用这个 Chem 呢，骨质的增生病也受到控制。有的病人呢，腰都弯了不能直，用了这个 Chem 以后呢，腰也变直了。还有些老年人出现了很多老年斑，也有皮肤很黑的病人也出现老年斑消退、皮肤变白的现象。所以我就决心要系统的研究 Chem 的疗效，并改进它所有的研究的方法，还研究一些复方。因为大家知道这个复方呢，并不是简单的组合，而是让它极大限度的发挥 Chem 的功效。Chem 呢也叫调钙素了，它主要的功能呢，能调节钙离子的浓度。大家知道钙是生命的信使，细胞的生命活动和钙的浓度有很密切的关系。体内钙的作用是由调钙素所控制的。调钙素本身呢，它就结合4个钙离子，随着细胞活动的需要，它可以协调钙离子的浓度。第二是它能维持新陈代谢的和能量代谢的启动和正常化的活动，那促进这个酶的活性。我们知道这些能量的启动和酶的活性跟 ATP 酶有密切的关系。那 ATP 酶呢的活性也受调钙蛋白的影响，甚至于跟它的关系非常非常的密切。所以这样的话呢，就可以使细胞活化，身体的能量呢转换很顺畅，而且我们体内的一些代谢速度呢可以维持常态。第三呢是协调神经系统和荷尔蒙。调钙素呢可以协助神经传导物质的释放，这样的话呢可以产生一些很好的效用，比如说增强记忆力，预防老人痴呆症，同时还可以促进肌肉能够正常的收缩，防止肌肉病态的收缩，比如说抽筋等等。同时呢也能安抚交感神经，这样的话呢就可以改善睡眠，尤其是夜间不眠的婴儿，少量的 Chem 都可以让他很平安的入睡。第4个作用是激活酶系统，进行有效的调整。酶系统是代谢的催化剂，当酶系统欠活泼的时候，营养的转换就变慢，形成障碍，身体的代谢速率呢就缓慢。第5呢是活化巨噬细胞。大家知道巨噬细胞是很重要的体内清道夫，它负责清除体内坏死、异化、老化的细胞。比如说我们说老年斑啊、疣啊、息肉啊，甚至于对一些癌细胞，它都有清理跟吞食的作用。所以 Chem 可以说是健康食品中很难得的防癌、美容、防衰老、防骨疾病的圣品。
Examination of professional instruments. An ideal BMD densitometer should have such features as accuracy, highly sensitive, easy operating, etc. In recent years, conventional radioscopy and dual energy X-ray absorptiometry have been used on a BMD test. Conventional radioscopy, generally X-ray, can't precisely show osteoporosis until bone mass or total bone calcium contents decrease by 30%. So conventional radioscopy is insensitive and inaccurate, especially in detecting early osteoporosis. Dual energy X-ray absorptiometry, two different energy X-rays scanned examined sites. Then a glittering detector receives the X-rays piercing through, with data analyzed by computers. BMD can be calculated. The diagnosis will compare the examinee's BMD value with the BMD chart on the computers. This kind of examination can measure systemic BMD. It clinically examines lumbar vertebra and neck offermer, with a precision error of about 1% only. The scan time is quite speedy as well. Also, the radiation dose of each scanning is around 1/50th of one-time chest X-rays, making this procedure much safer. Now dual energy X-ray absorptiometry has developed from first generation to third generation. Preventative medicine and healthcare medicine have gradually been accepted as important. The third generation dual energy X-ray absorptiometry can provide people with high risk of osteoporosis have a fast and accurate BMD test and see their own BMD chart promptly. With a BMD analysis through professional services, advice on a health preventative method suitable for you can be supplied. After 3 to 4 months you started doing your health preventative method, you have a BMD test again. Third generation dual energy X-ray absorptiometry can tell you the difference in your BMD. Self-examination for osteoporosis. Now you know the truth about osteoporosis. You can do an easy self-checkup for osteoporosis. See if you have any of the symptoms below. 1. Bending down in a forward position makes you feel pain. 2. Pain on back and waist when getting up. 3. Backaches. 4. Slight actions result in fractures. 5. Cannot sleep flat on your back. 6. Body aches when turning over. 7. Hunchback with chronic backache. If you have one or more of the above conditions, maybe you are at risk of having osteoporosis. Calcium is the flame of life. A fixed amount of calcium is necessary to balance physical function and prevent osteoporosis. On the other hand, calcium is continuously consumed in the mutual function of osteoclast and osteoblast. Therefore, the Department of Health appealed to people for a daily sufficient intake of 1,000 milligrams of calcium to provide us with our needs. However, the latest medical knowledge shows that calcium can't